Doing really well here, Neil, and you?
Fantastic. In today's topic, male and female infertility. What is the worldwide infertility rate for men?
10 to 15% of men experience difficulty conceiving.
What are some of the factors that influence male infertility?
Well, there's geographic location like Central and South America. I don't know what they're doing over there. They have higher rates. Then there's chromosomal disorders. One of the most common is XXY. Ordinarily, it is women who have XX and men who have XY. Sometimes things don't go quite right and you get an XXY. These have the external appearance of being male, but they're tall and thin and almost always infertile.
What are the lifestyle factors that influence infertility in men?
Of course, smoking is always blamed for everything, as is alcohol consumption and illicit drug use. And obesity. Those are our favorite go-tos when it comes to blaming people.
What are the what are the medical conditions that negatively impact male infertility?
There are hormonal factors like high prolactin levels. There are also chronic ailments like lupus. Then you have bacterial organisms, ureaplasma, mycoplasma, and those are they're the smallest bacteria that can still reproduce. You also have parasites like toxoplasmosis, of course, chemotherapy, radiation therapy, they can all negatively impact male infertility.
Is a complete lack of sperm common?
It doesn't occur very often, but in men who are infertile, 10 to 15% have no sperm at all.
What is the best age for a man to become a father?
Well, the most common version of that is late 20s to early 30s. The Guinness Book of World Records says that the oldest man was 92 years old at the time of the birth of his child.
Hmm. Can genital infection with uroplasma cause infertility?
It certainly can. And this is a very controversial topic. I've been talking about it for 45 years, testing for it. I had a huge infertility practice in Fargo for decades that was built on the premise that for women and men who have trouble with conception, that ureaplasma played a big role. I treated them, and they actually, most of them, wound up getting pregnant and staying pregnant.
Can uroplasma live inside mom's uterus?
Ureaplasma not only can, but does live inside of mom's uterus. It can pass through the membranes into the amniotic fluid and infect the baby.
Can ureaplasma cause miscarriages?
Absolutely, it can cause infertility, miscarriages, preterm rupture of membranes, preterm labor, fetal distress, and stillbirth.
Is ureaplasma common?
It is, that's one of the reasons that some people think that it is not a pathogen, but it can occur in 60 to 80% of adults. And I think that it seems that there are some people who just do fine with it. But again, for those people who have infertility, I think it's really important to test for ureaplasma.
What are the symptoms of a ureaplasma infection?
For the most part, men and women are asymptomatic, and that's another reason that people, at least some people, think that it is not a pathogen. I do not agree with that.
Is ureaplasma sexually transmitted?
It certainly is. When I was working with my infertility patients, I found that I had to treat both mom and dad if I wanted to get anywhere. That is, get them a normal, healthy living, newborn uh, out of their pregnancies, which had previously either failed or didn't happen at all.
What is the treatment for urea plasma?
The treatment depends on whether you are or are not pregnant, but if I diagnose a mom during pregnancy with ureaplasma or mycoplasma, the treatment of choice is erythromycin for mom and doxycycline 100 milligrams twice a day for dad, and these treatments last 10 to 14 days. If mom isn't pregnant, she gets doxycycline too.
Is there a connection between urea plasma and endometriosis?
You got it, Neil. Yes, there is, I think. There are people who think that sometimes ureaplasma actually induces endometriosis. I think that probably the most common explanation would be that it makes adhesions that look very similar to endometriosis.
During the workup for infertility, are urea plasma and mycoplasma commonly tested?
Not everybody tests for these things routinely. It's, I think it's been problematic for a long time. Again, there are people who don't think that these bacteria cause any trouble, but we're seeing more and more now people talking about the trouble that they do cause.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
Let's see the book again.